take a look at our next step in this judgment model, which is the analyzing cues. So what could these findings mean? And so many of you already said preterm labor, right? But let's take a look at all of our other options as well. So we have placenta previa here. What do you all know about placenta previa? What are some symptoms of placenta previa? If you remember, placenta previa is when that placenta implants low over that cervical opening, as you can see in the bottom right picture. So it implants low over that cervical opening versus up high here at the fundus of the uterus, or the anterior side. So placenta previa, what does it cause? What are some symptoms? We're going to have vaginal bleeding, right? Yeah. Okay, so what is characteristic? Somebody said we have painless, bright bleeding, right? That is absolutely correct with placenta previa. But she's experiencing some pain, right? She's having these contraction pains or uterine cramping, as she said. So I don't think that it's previa because of that. If she was having painless vaginal bleeding, or if it was bright red where we have that bright pink color instead, then I might be concerned that it's previas. And previas are also usually diagnosed earlier in pregnancy, so it probably would already be known. Our next option here is a pulmonary embolism. So what do we think about a pulmonary embolism? What is it? It's a clot, right? And what happens is that it's going to block here, an embolus in that pulmonary artery, going to block blood flow. Does anyone think that it could be a PE? What's making you think it, or what makes you think it's not? We kind of already talked through some of this. We have that slightly elevated respiratory rate, right? But again, that's expected at the end of pregnancy. And our pulse ox was normal. So as you see here in pregnancy, as that gravid uterus grows, that fetus grows, that uterus grows, it's going to push up on that diaphragm. And so what happens is when we take a deep breath, that diaphragm cannot move fully down to allow those lungs to expand. So I'm thinking PE is not likely. It looks like you all are still agreeing with that. So our last option here is an intrauterine fetal demise, or an IUFD. So an IUFD occurs when we have a fetal loss that happens after 20 weeks gestation. So she is after 20 weeks gestation. Do any of our findings indicate an IUFD? So she hasn't felt the baby move much today, right? So we definitely need to assess that, but it could just be a deep fetal sleep state. So remember, for this, we're looking for what is most likely occurring, most likely happening. And with our given information, I think what's most likely occurring is going to be that preterm labor, right? Because our vital signs are not showing us a PE. The bleeding is a little bit painful. It's not painless to indicate previa. And just because she has some decreased fetal movement does not mean that we have an intrauterine fetal demise. All right, so what is it? What's going to be our final decision here? What are we thinking? It's going to be, our preterm labor. Perfect.